We're going to have actors play the part of the patient and the family members, but we actually use real clinicians to play the other roles. So everyone you see is what they say they are, and they will just do as they do in practice.
Fine, doctor. It's my chest I'm really worried about. It comes back and coughing and waking her up in the middle of the night, and she just gives me all this.
His legs are swollen as well, you know.
But Mama, वो ठीक है.
मैंने समोसे बनाए.
समोसे बनाए.
You mustn't eat samosas. This is the problem.
But at least let me eat something that my mom makes.
Well,
she enjoys.
Why don't you tell her? क्यों बनाते हो समोसे?
They've amputated my toes, and I really don't know because I've lost my job now. How can I find? As if I'm senseless. You married an idiot.
You are.
No,
if you could have saved your feet.
Have you cut down on the smoking, Mr. Arch?
Yeah. Answer that.
It's taking real life case studies and it's about applying solutions to those and seeing how it might have changed it. And it didn't, the changes didn't make it a perfect scenario. There were still issues that needed tweaking, but it's a way of simulating, it's a way of testing out how things might work.
What information did we get from the discussions? Well, the biggest one was motivations, more peer support. Also, education was another big one for motivation. So there was talks about having a diabetes mentor, which was seen as quite important, or a champion.
Why are you sending in non-doctor person? I want to be seen by doctor.
They are diabetes mentors. Mentors, yeah. They themselves got diabetes, but were well controlled, very well educated in terms of how to control his diabetes.
But how will they help me?
They will help.
You can talk to them.
How do you manage? I mean,
yeah. Oh well, I've had quite a lot of help over the years actually, and I think there's quite a lot of help out there. With things like diet and smoking and.
It's bloody torture for me. I mean,
he was actually referred to hospital. To the diabetic services, but for some reason it sort of got lost in the system, so he never actually...
We referred him again when I saw him previously.
Yeah.
I mean, it takes a little bit of time, maybe a couple of weeks.
Well, I think initially it just got lost in the system and he never actually got an appointment. So
a lot of people knew a Raj, Tony, our clinical lead for diabetes. It's interesting, first thing he said when he stood up was actually, I met a Raj yesterday, and he knew exactly the person.
I just think it's been a marvellous 2 days. I think it was very informative in every way. And we hope this is the future. It's just care that is a continual care, and this is the most important thing.
You can really feel that this is a real situation, and people are talking over each other, and you can't necessarily get your point across, or the point is missed. That is very real, and actually that enables you just to keep it in here and now, as opposed to thinking very theoretically about things. I think it brings you back to a very practical point.